Okay, so it's 7:34 and I think we should start with the webinar session right now. So hello and good evening. It's me, Dr. Malkani Aditi Ghansham, BHMS PG scholar from Srimati K.B. Abad Homeopathic Medical College, Chandwad, Nasik, Maharashtra. I am addressing you all here for today's webinar. Good evening and warm welcome to all attendees and respected guest speaker of our today's webinar, Dr. R. Samaran. Sir, today's webinar topic is exploring the role of homeopathy in surgical cases. Before introducing our today's speaker, initially I would like to thank Dr. Lavanya Sai, BHMS MD, PhD scholar, National General Secretary of AIHSAYA, All India Homeopathic Student and Youth Association. Also, I would like to thank Dr. Arpana Sandeep Parikh, ma'am, Professor and HOD of Department of Repertory, Srimati K.B. Abad Homeopathic Medical College, Chandwad, Nasik, Maharashtra. She is our today's webinar organizing secretary. Now, let's introduce our today's webinar guest speaker, Dr. R. Samaran, sir. He is Associate Professor, Department of Organon of Medicine from RVS Homeopathic Medical College and Hospital from Tamilnadu. I would like to ask Dr. R. Samaran sir to continue with the session and give a brief insight on the interesting today's topic, exploring the role of homeopathy in surgical cases. Sir, please proceed ahead with the webinar and give insightful information.
Thank you, Dr. Aditi. So, good evening, all. So, it gives me immense pleasure to share my thoughts on a topic that bridges two seemingly contrasting streams, that is homeopathy and surgery. So, the word surgery is very contentious. When we complete our undergraduation, we get our degree, BHMS, which stands for Bachelor of Homeopathic Medicine and Surgery. If you see a few decades back, there was a lobby to remove the word S from BHMS. They said that only BHM can be given, Bachelor of Homeopathic Medicine, and surgery should not be given to the alternative system doctors. And even surgery should not be taught to the students of alternative medicine. But to reasons unknown, it didn't see the light of the day. So today we are going to explore what are the things which are possible, though it is called as surgical cases. In homeopathy, it is not typically a surgical case. So it can, we can call it as pseudo-surgical cases from the allopathic perspective or the conventional medical system. Just a minute. The screen is changing, madam?
Yes, sir.
As okay. So I think most of the participants today are students. So you know any importance of this particular photo or image of our master? You can just put in the chat box. So what is the importance or any historical information regarding it?
As a tribute, because of whom we all are here in homeopathic field.
Okay. Anything else of historical importance? This particular image? Okay, we will continue. This is the only image or the real photo which was taken during his Hanuman's lifetime. So this particular image was taken in September 30, 1841. So the particular camera was used to take this particular image. It's called as Dagru type of camera. Only two cameras were available in the world during this particular time. And the photographer is M. Fakult. So you have to be still for around 20 minutes. So Hanuman was little sick on this particular day. For 20 minutes, he was still. So you can see the face also, he was little irritated. So this is the history behind this particular photo. All the images, what we are seeing generally of the image of Hanuman is maybe a drawing or something like that. This is the only photo taken during lifetime. So we'll go to the next slide. So coming to what is surgery. So in medicine, the word surgery is derived from Greek chirurgical or Latin chirurgia, which means handwork. And we know that the father of surgery in India is Shishruta. So we are closely correlated or with the surgery and the homeopathy. So surgery is an art and science by itself. It is that branch of medicine which is concerned with the repair, removal, or replacement of the diseased tissue. So, surgery represents the tremendous technical achievement of orthodox medicine on one side. On the other side, it demonstrates the ability to cure. Because at present, we have robotic surgery also. In future, we'll have AI. Most of the things will be done by the computer itself. But still, it states that the medicine cannot cure it. So, we are like, it is mostly a palliative aspect. So, surgery itself is never curative, only palliative, as it does not cure the underlying pathological process that caused the problem to occur. The morbid functioning which produced the ailment remains unchanged by such removal. That is why we see many times, even after surgery, people come with the same problem again. Like example, nasal polyp. If the people are doing surgery again after few months or after years, again nasal polyp comes. Or renal calculi, they are going for surgery again. The renal calculi forms. So it is not a curative aspect. It is only a palliative one. So surgery comes into play when the physiological and pathological changes cannot be brought back to the normal by medication. So when the part becomes irreparable, we replace it or remove it and the condition improves. So surgery is called forth in conditions where medicines have limited or no role, where surgical aid or operation can improve the condition. There are few indications for surgery where we have no other options, only surgery can be done. So example, there may be an actual defect or deformity of the organs at birth congenitally. Example, we can say like cleft lip. So here, no amount of any amount of medicines or any different types of medicine systems, nothing can do anything. So only the surgical can give a relief to the patient. Or ventricular septal defect, where only surgery can offer a solution to it. And there are end results of pathological products in disease which cause excessive discomfort. Example, there is aneurysm of aorta or excessive ascitic fluid or pleural effusion, retention of urine. In these conditions, only mechanical interventions such as tapping, catheterization may be required to relieve the patient and to promote the cure. Because we have seen many cases where we have to do puncturing and then we have to give our medicine so that recurrence can be stopped. But that end product has to be removed surgically. There is no other options. And later on, there are certain diseases, though we have cured it, but in real senses, the organism end product disease remains behind, just like in the previous example. For example, a big calculus is there in the kidney. We are giving the medicines, maybe constitutional or asthmatic level prescription. The tendency to form the stone has been stopped, but still whatever is formed earlier cannot be removed. So these things has to be dealt with surgical aspects. The next one is conditions arising from external causes like wounds, hemorrhages, and here are fractures where only surgery is the option. We have no other things because we know that, for example, there is a commuter fracture or compound fracture. We have to bring back into position. We have to put plaster of Paris, and then we can give them medications. But without coming into the proper oppositions, we cannot give any medicines and it not relieve the patient. So surgery is the only option here. So in cases like Pott's disease, complete immobility has to be achieved by surgical application of plaster. In certain diseases, for the purpose of diagnosis, surgical procedure may be needed. Example, lumbar puncture, bronchoscopy, sigmoidoscopy, or biopsy. In these situations, even for understanding what disease the patient is suffering from, certain surgical procedures are required. The next point, patient under treatment who is having a sudden emergency condition requiring surgical operation. Example, perforation of peptic ulcer or perforation of appendix or internal hemorrhage and strangulation of hernia and sudden obstruction in larynx as in diphtheria requires immediate tracheostomy or the particular procedure, and here surgery is the only option. So these conditions, homeopathy cannot play a very great role because Hahnemann himself has spoken in the aphorism 67 where there is imminent danger to the life or something like that, you have to go for the antibiotic measures and surgical measures. So one thing we have to understand that though we are homeopathic physicians, we should have a very clear demarcation and which kind of cases we can take and which kind of cases we have to refer to the surgical aspect. Because Stuart Close have spoken regarding the scope of homeopathy, and every student would have read this very completely regarding Dake's exposition and propositions. So the ego of physician should not interfere with the objective of giving relief and saving the life of the patient. So by the use of surgical measure when the medical treatment has clearly failed. So this is very, very important because in practice, we find that there are two types of doctors. What we find, one is fanatic of homeopathy, where every case which comes, they will say that the homeopathy can give relief and cure the conditions. But there is other one who doesn't believe much in homeopathy or who is vice versa. They may say 50-50. So we have to take a middle path where we are very clear regarding the pathology, what is happening inside the body, and how much our medicines can give relief to the particular conditions, and what is the possibility of using certain mechanical measures. So it has to be, both has to be utilized to give relief to the patients. So coming to the concept of disease, you know that homeopathic concept of disease per se is nothing more than an alteration in the state of health caused by the dynamic action of inimical forces. So it is a very vast difference between the concept, homeopathic concept, and the conventional medical concept, because as Hahnemann has spoken regarding the old school, that is nothing more than the conventional concept where they speak of the materialistic aspect. So something, a tumor is there, or maybe a cyst is there, or something like that. Once they feel that once that is removed, then the disease is completely cured. So the concept of seeing the disease pattern itself is different from the conventional medical viewpoint and from the homeopathic viewpoint. So we have this totally a different approach. So coming to the classification of disease, this every student will be knowing that when Hahnemann has clinically classified the disease, first thing he divided is surgical disease and dynamic disease. So whatever comes under the surgical diseases, it cannot be treated with homeopathic medicine, and it is a purely surgery. Only surgery can give relief to the patient. So coming to the dynamic diseases, we have local diseases again, which is two types. One is external cause, other one is internal cause. So an external cause which is arising due to an external condition, so injury or fracture like that, here surgery has to be given along with the suitable homeopathic medicines. But internal cause, which is caused by an miasmatic aspect or due to an underlying condition, this has to be treated with homeopathic medicines. And here, in rare cases, surgery may be required, but mostly homeopathic medicines can relieve it. There are number of diseases which are labeled as surgical where homeopathy works curatively and can avoid surgery. So there are ailments, for example, like tonsillitis, piles, fissure in ano, fistula, appendicitis, CSO and chronic otitis media or acute otitis media, vocal cord nodules, polyp in nose, ear, kidney and biliary stones, small size uterine fibroid, ovarian cyst, warts and cons. So these are few examples which I am giving, which are we are reading under a surgical test aspect, and it is purely said to be a surgery case, but we can give a very wonderful cure with the medicines without going for the surgery aspect. So homeopathy is not against surgery, because Hahnemann has given clear instructions where surgery has to be utilized and where surgery should not be utilized. The first example what Hahnemann gives is regarding the seventh aphorism footnote, where he says regarding causa occasionalis exciting or the maintaining cause. He gives examples of mechanical application, like which comes under the surgery aspect. Examples what he has given in the seventh aphorism footnote is that extract from cornea the foreign body that excites inflammation of the eye, or loosen the overtight bandage on a wounded limb that threatens to cause mortification, and apply a more suitable one. So lay bare and put a ligature on the wounded artery that produces fainting, and extract foreign substance that may have got into orifice of the body, or crush vesical calculus. So Hahnemann is very clear which cases we have to go for general management or a mechanical removal of the disease conditions, and which cases homeopathy has to be applied. Just coming to the very important aphorism, that is 186. So Hahnemann has clearly said injuries occurring to the body from without, and these diseases has to be relegated to the surgery. And gives a lot of examples again, like reduction of dislocation and bandages to bring together the lips of wounds, or extraction of the foreign bodies that have penetrated into living parts by making an opening into the cavity of the body in order to remove an irritating substance, or to procure the evacuation of effusion or collection of fluids. So by bringing into opposition the broken extremities of a fractured bone and retaining them in exact contact by the appropriate bandages. So all these things, I think students, most of you would have read it. And Hahnemann is very clear. These conditions cannot be dealt with medicines, but only with the mechanical measures. At the same time, Hahnemann is not completely avoiding the homeopathic aspect. He says, in these injuries, the whole living organism requires always an active dynamic aid. So it is not that only it is purely a surgical case. So you do a surgical procedure or a mechanical intervention, but along with this, our medicine has to be given. He gives along with this a local complaint. The full organism will have like violent fevers resulting from extensive contusions, or lacerated muscles, tendons, blood vessels, requires to be removed by medicine given internally, or when external pain of scalded burn parts need to be homeopathically subdued. So here, the service of dynamic physician and his helpful homeopathy comes into requisition. So I think every student would be very clear which level homeopathy can be given and which level the surgical options can be opted for. Just in aphorism 189, he says that no external malady can arise, persist, or even grow worse without some internal cause. So this is the first aspect is regarding due to an external cause, and here it is because of the internal cause, which is the disease is arising. So he is because of miasmatic expression. So again, in the last line, he says no eruption on the lips, no whitlow can occur without previous and simultaneous internal ill health. So, on one hand, surgery can play an important role in medicine since many conditions, such as congenital deformities, already we have discussed all these things. At the same time, surgery is often performed unnecessarily. So, we find in the present scenario that any condition you go, immediately surgery is given. A child who is having tonsillitis 2 times or 3 times, they give antibiotic, and again they say, okay, this is not cured, you go for surgery immediately. Or a nasal polyp case, immediately go for surgery. Or a sinusitis, it is not relieved, go for surgery. So, it is done very commonly. So this can we can play a very great role in minimizing the surgical interventions. So homeopathic surgery is that form of treatment where the so-called surgical cases can be averted, managed completely, or helped in the pre-operative and post-operative stages with homeopathic medicines alone. So since surgery is an integral part of the medicine, Dr. Hahnemann has not left it untouched, and he has very clearly advocated it in certain conditions, and it's manifest in the reference of Organon. Already we have seen those references. So homeopathy in the field of surgery. The first one is it often avoids surgery. So I have said a number of cases like we have said tonsillitis or maybe cons or cyst or some ovarian tumors, all or fibroids or breast lumps. Everywhere surgery can be avoided where the conventional medical system is not having much option. Second, it gives an external excellent in the prevention of pre-surgical anxiety and tension. Many times in my practice, people who are going for root canal treatment or people who are going for the extraction of tooth or going for surgical measures, I commonly give aconite. It gives very wonderful results where certain times after the during the surgical measures also they take aconite, and after they coming back from the surgery also the aconite or arnica gives wonderful result, because many times in the anxiety aspect we think only of aconite, but arnica also has the anxiety and tension just like aconite, and both the remedies are very much helpful. Other remedies during this prevention of anxiety and tension during the surgical aspect is that we have remedies like gelsemium, which gives a very wonderful result. And most of the, because whatever remedies I'm saying, I have used it in my practice, it has given result. Only those remedies I'm saying, not all the things. The other one is argentum nitricum, based on the constitutional approach, or silica or lycopodium also is giving result. And all these things you have read in general regarding the anticipatory anxieties, and these has given very wonderful results in prevention of the pre-surgical anxiety and tension. The next one is controlling bleeding during surgery. For example, just like previous example, common people coming here is that regarding removing of decayed tooth and other things. So we are given remedies previously to them, an arnica, hamamillers, or phosphorus, and this has controlled bleeding to a very large extent. The next aspect is that it controls the healing time also. So once after the removal or after surgical aspect, arnica is one remedy, because why I'm repeating arnica, arnica is suitable for all kinds of surgery or whatever may be the given conditions, to heal and then to reduce the inflammation and then quick recovery and bringing back the parts to the normal aspect. It gives wonderful things, and this is commonly used in the practice also. And other thing is that we can avoid surgery also. For example, in nasal polyp conditions, the remedy which I commonly use is natrum ars, a very wonderful remedy, which is my first preference in my clinical practice. The second is lemna minor and ticrium, which gives very much good results in nasal polyps. And cons also, which commonly the patients nowadays use corn caps, otherwise they go for a minor surgical procedure to remove the cons. But we have remedies like antim crudum, graphitis, and thuja, silica, antim tartaricum, and these remedies gives wonderful result in cons. The next one is calcaneal spur, where they commonly go for uh, some minor surgical aspect, or they cannot do anything because they have to use some MCR chapels or ortho chapel or something like that. But we give them medicines like calcarea flor or calcarea carbonicum or calcarea any kind of calcarea remedies according to the totality which is evolving, which gives very wonderful results. And number of cases of calcaneal spur which are commonly related to surgery can be prevented going to surgery. Then tonsillitis, very common in our day-to-day practice. Being a student, you would have seen many pediatric cases comes to us. Common remedies like bell, beretta carb, iodum, calcare iodatum, or agraphis nutans, and these remedies gives wonderful result. Only thing you should have to know how to repeat. Very commonly, for a beginner, going with 30 potency and then with frequent repetitions, you get very wonderful results. And these remedies, you just try it in the practice when a patient is having in maybe any condition. If you're not very clear with it, go with belladonna or beretta carbonicum, which gives around 80% of the cases that is improvement in these conditions. The next one is tooth caries. So when the tooth is decaying, and then nowadays the root canal treatment is very common. Merxol is one remedy which gives very much good relief, because I have seen many of the dentist itself is saying that the tooth decay has decreased, or sometimes there is pus formation in the things and they have to clean it. But after taking our homeopathic medicine, they go for the visit to the dentist, then they say that okay, nowadays now that nothing is there, it doesn't require any RCT or any of the interventions. The chamomilla and coffea also is very much good relief in tooth pain relieving. The next is ASOM and CSOM, which is commonly relegated to surgery. Remedies like plantago, silica, Hapal self, and graphitis are giving good much relief. Sty is another common condition where there is inflammation of the upper eyelid or lower eyelid. Pulsatilla, bichromicum, and silica is giving wonderful results. Sinusitis, very common is Bryonia and Calibicromic. I'm just saying one or two remedies. I'm not going into the complete aspect of repertory or other remedies, but these remedies gives most of the case. That means 50% of the cases gives very much good result. Varicose vein, that is also many times they go for stripping, which is a surgical conditions. But coming to the homeopathic perspective, all kinds of snake remedies are very much helpful. Along with that, hamamillas and phosphorus are also very much helpful. But Naja, Lacasis, Crotalus, and these kind of remedies are giving wonderful results in treating the varicose vein, which is commonly relegated to surgery. And what's only aspect in allopathic side is okay, they go for maybe salicylic acid preparations and other things. Otherwise, it is like a surgical thing, a minor surgery is prepared. So remedies like causticum, thuja, antimtat, silica, and these remedies gives wonderful result. So bleeding in general, it may be already I've spoken this, phosphorus, arnica, and hamamillus. Next is keloid. In cases which goes to surgery and after maybe after cesarean section or after a minor surgery, people come with keloid or hypertrophic scare, or it is very painful scare, or the non-healing of the scare. This thing, remedies like calendula, very good results, and thiocyanaminem. I think we would have read therapeutically in surgical classes also. And calcarea floor, these minimize it. Not every case, certain times this keloid, which is very extensive, takes a very long time. But one thing is that it is not progressing after our remedies. If it is a very small keloid, it can be completely resolved with our homeopathic medicines. Then coming to kidney stones, that is also one common conditions where allopathic side always go for lithotripsy or breaking the stones and remove it. But we have good remedies like Berberis vulgaris, I can say, is the first remedy. It may be on any side, maybe left side or right side, with wonderful results. And other things like lycopodium, cantharis, staphysagraria, these remedies also. And all these remedies gives wonderful result in potency. At the same time, in certain conditions, you have like, for example, renal calculi or gallbladder stones or something like that. You have remedies like Chionanthus and then Chelidonium, Berberis vulgaris tincture, Osimum canum. And these also is giving wonderful results. With medicines, we can treat these conditions and bring back the patient to normal without any interventions. So these are common examples what we find in the day-to-day practice, and excellent in the post-surgical complications also. Example is anesthesia effect. Common remedy which I give after anesthesia effect is that Naxwamica, because it is commonly said in our keynotes itself. The next one is amyl nitrosum and opium. And these three remedies are very helpful in removing the anesthetic effect or after effects of anesthesia. Gastrointestinal disturbance like nausea, vomiting, constipation, and flatulence is very common after any kind of surgery or maybe in abdominal surgery in specifically. The first remedy is staphysagraria, which gives completely relieves the patient in most of the conditions. Other remedies like carbovage, China, these also is giving wonderful result. For swelling, stiffness, bruise, pain, and soreness, including gynecological and orthopedic conditions, the common remedy I consider after a surgical intervention is bellis pernis. So that is one remedy we have to give frequently after the surgical intervention. And then Rustox, particularly in 1 potency, is acting very wonderful in reducing the swelling and stiffness conditions. So this can be used for, and ruta also is the ruta and rhododendron conditions also for these kind of conditions. Infection, we have echinacea in tincture form also, it is helpful, and then in potency also. And pyrogenum, any kind of infection after surgery, for example, they do a surgery and then after that they find that there is infection, the patient is coming with fever. So pyrogenum is one wonderful remedy which reduces the infection to a very large extent. And excessive scarring, already I've spoken regarding the hypotropic scare or keloid. We have a thiocyanamidum, calcarea floor, and silica. But only thing, potency, and it takes little long time to control these scarring aspect. That also has to be considered. So these are common things which in day-to-day practice, which I'm giving a general opinion. Next, we are going for post-surgical thing. I have taken from the repertory. So common remedies like arnica, bellis pernis, calendula, staphysagria. You can use in any condition, for any condition after surgical aspect. These remedies are very wonderful, and calendula plays a very important role even for episiotomy, suturing, or after cesarean section. Calendula heals wonderfully the injuries, and the staphysagria and bellis pernis and arnica also is very useful. Next, I will go for the case studies. So first one is a case of breast. Any queries till now? Any queries you have, students especially? We'll continue. Any doubts or any queries in particular? Continue. It's a case of breast lump. So a 56 years aged female came with the complaints of multiple lumps in both the breast, observed for the past 4 months. So she had on deep pressure a mild tenderness in the right breast, but left breast there's nothing, was it was insignificant. And she had a history of injury to her chest due to fall from road traffic accident 8 months back. So this was the only history we got during the case taking aspect. Along with that, she also suffers from busting pain and frontal region once in 2 months for the past 1 year, which is better by pressure and rest. So there is no any significant past and family history. Physical generals which are to be noted particularly are thirst is decreased, craving sweets, bowel habits once per day, heart stools not satisfied, and perspiration is increased in general, thermal state chilly. So patient is a housewife from middle class family. She is mild in nature, likes to be in company. She is spiritually inclined and interested in meditation and yoga, voracious reader. And someone contradicts her, she will not reply, or she will not speak back or gets angry. She keeps quiet but does what she wants. She comes directly to homeopathy because she has firm belief in the system. So these are common things. Everything is within the limits. So on local examination, on the right side, on palpation, we find rubbery mobile lumps, tenderness present, and lymph node is enlarged. On the left side, there is rubbery mobile lumps and no tenderness, and no lymph nodes are enlarged. So if you see the mammogram, there is isodense lesion with slightly irregular borders in the left breast. So the size, largest one size is 11 into 8.5 mm. On the right breast, there is a vertically oriented complex lesion measuring 15.2 into 9.4 mm. This is the largest, and there are other minute ones also. So this is the report what we are getting. You can see both the things are in Barrett's 4 lesion. That is a suspicious abnormality. Anytime it can go into the last one category, that is 5, which is highly suggestive of malignancy. But I suggested the patient to go for FNAC also, but the patient was not interested because she said she don't want to go for any procedure, and this itself is very troubling her. So patient did not go for the biopsy. So with the available data, we proceeded. So these are the rubrics or the totality which we have considered: mildness, company desire for, anxiety, health about, heart, tumors, mammae, and then mammae injury from pain, forehead, pressure, external application. Any remedy you can suggest? Any remedy from the available totality? Any remedy?
Cytolacca.
Pardon? What remedy? I could not get it. So going to the repertorization. So we have taken the 8 symptoms. We find remedies like phosphorus, silica, pulsatilla, and other things. So considering the complete image of the patient, initially I went into the constitutional prescription. So I have selected Silesia here. So this was a remedy which was selected as the constitutional prescription. So first Silesia 202 doses weekly HS was given for 2 weeks duration. So after 2 weeks, when the patient came, there was no changes in any of the symptoms. So again, Silesia 200 weekly HS was prescribed. After 2 weeks, when the patient came, there is no much changes. So I don't want to change into the remedy because I felt that silica is a constitutional aspect. It may give certain relief to the patient. So again, the same remedy was prescribed. So when there was no change, we thought of increasing the potency. So Silesia 1 2 doses was given for 1 month. That is 2 weeks once one dose was prescribed. So no change. Again, same pattern was prescribed. But with the 200 potency, you can see there is no headache, no heart stool, and once the things generalities have improved, that is why we thought that okay, the patient is improving, and then we went into Silesia 1M as the 200 potency was not giving much relief, but the 1M did not produce much desired result. So we went into the sector level totality. So you can find there is a conium maculatum, which is given glandular induration of stony hardness and mamma in persons of cancerous tendency after bruises and injuries of glands. So we go into the history, we find that the patient had a road traffic accident and she has fallen directly on the chest region. And after that, few months after that, she started finding the lumps. And that is how she does developed. So based on this particular aspect, we went into conium 30 TDS. So it was prescribed for around nearly 4 months duration. And after that, there was slight reaction on 10/6/2011. The swelling in the right breast was there, and then it was warm and tender. So conium was again considered. And after 2 months, there was discharge of pus and blood in the right breast. So it was little, the condition is severe. So much pus was coming outside and blood was coming outside. And then we told to clean and maintain the hygiene. And the patient was very cooperating. She did not again go for the allopathic situation. And after 2 months of duration, everything stopped and there is no discharge and no swelling in the right breast. The lump size also decreased to a very large extent. So the patient was improving. So as it was prescribed on the sector level, we went into a frequent repetition. Again, conium was prescribed. No change was there. So we went into the mathematic level approach, and then Tuja 1M was chosen and given 1HS, 1 dose, and followed with conium. So there was no much result, and then we went into a mineral remedy, that is glandular enlargement and tumor from injuries. So Beretta iodatum was prescribed again for around 6 months duration, and then you can see that after that the mammogram in the last 18 for last line, you can see mammogram both the breast showed normal steady. So this shows that when we prescribe the proper remedy, there is a very drastic change, because the patient initially what happened, the people said that you have to go for surgery, we will remove all the lumps or something like that. You can find the before report and after report. So Barrett's category 4 lesion. So we can say it is a carcinoma breast, but patient did not go for biopsy, so we don't have the particular report. But after 2.5 years of treatment, all the quadrants shows normal study, and the patient was very happy. And even now she is surviving. There is no any issues or recurrence of the complaint. So it shows the homeopathy has very good result in common cases which is going for surgery. Next, I'm going for a case of hydrocele. So this is a 15 years aged male, came with the complaints of scrotal swelling, which is a size of tennis ball for the past 2 years. The patient, how it started is the patient was riding a cycle with the bar, and then suddenly his friend has pushed him from behind, and then he has fallen on the bar and he got injured in the scrotal area. And after that, the swelling slowly started. And the patient was little poor patient, so patient could not go into the treatment. So the remedy prescribed on one particular criteria, ailments from injury, arnica was prescribed. So this is the first thing when the patient came. The patient was poor, so he did not go for surgery also. It was given an BD. After 1 month, you can see the improvement. So they went in initially for a doctor. They said you have to do a minor, because you know the hydrocele, what is the procedure? A minor procedure has to be done and the liquid has to be extracted. But without anything, within 1 month, the patient is completely all right. Okay. After that, the boy did not get any of these complaints. So before treatment and after treatment. Next is a case of paranoia. 46 years old male, came with the complaints of swelling and severe pricking pain in the right thumb for the past 4 days. So this patient is a cook. So he was cutting vegetables on a wooden this thing plate, and there was a slight wooden thing which has entered into his fingers, and after that it started. Pathological prescription was done based on the sector level. Myristica sebifera was given. The reason is it is a great antiseptic powers, inflammation of skin and cellular tissue, and periosteum, traumatic infections, and specific action in penaretium. So you can see the infection in the first picture before treatment. There is the lanula is not seen. The moon of the nails is not seen. It is completely swollen. And the next picture you can see how much is the improvement. So it is within 2 weeks duration, because it is a typically you have to give incision and remove the pus and everything. But Myristica sebifera 2 pills TDS was given for 2 weeks, and the patient has completely improved with the homeopathic medicine. So next is a case of renal calculi. It is very common as students. So this will give you little understanding. So a patient came, 50 years old patient, and previous history of renal calculi, and twice he went for surgery. Again, it recurred again. That is why I said initially that surgery is never a curative option. It is only a palliative option. And many patients comes with the same complaint after certain time period. So later on, he opted for the homeopathic treatment. So I'll directly go into the so this is the report where he has two calculi. You can find left kidney measuring 5.6 into 3.4 mm, another is 4.7 into 4.6 mm, and clinically it is diagnosed as the left renal calculi. So coming to the totality of symptoms, mild anxiety about his health and sentimental feelings. Appearance is lean, craving sweet, thermally hot, colicky pain, sweating with pain, abdomen distended after eating. It is very clear. It is a case of lycopodium. So we put the totality along with the general management. It was prescribed lycopodium 1 m, 2 doses were given, and second dose was SOS was prescribed, and no colicky pain, but the patient has taken the second dose also. So after 1.5 months, the patient did not have any pain, and then he felt that something came outside while the urine was passing, but he could not find out any stones. So after 1 month, the patient was advised to take USG abdomen. You can see the impression in the first USG report. There were two calculi, and then second, the left renal calculi seen in the LA scan dated cannot be identified in the present scan, and the impression there is no abnormality detected. And in this condition, no tinctures have been prescribed. Only 1 m, 2 doses has been prescribed. This is the beauty of homeopathy, because when it is matching with the patient totality, exactly when the correspondence is complete, the remedies acts like a magic, and it relieves the condition also. And after this, the patient did not got enough. The patient was I was in contact with the patient for the next 5 years. He was bringing other patients also, but in the 5 years, he did not got any renal calculi. Again, recurrence of renal calculi was not found in this patient. Next is a case of lumbago with skin tags. It is usually a cosmetic thing. A 42 years old aged female consulted for the complaints of lower back when rising from the sitting position and sore pain in the both the legs. The patient mainly came for this lower back pain, and then along with that, the patient also had many skin tags in her neck, and it was slowly increasing in the numbers. And there is no any particular significant history. The patient is chilly patient and craving for fish. And neck, you can find numerous small blackish pedunculated fleshy papules. So skin tags were found. So considering the totality, likes company easily affected, craving fish, perspiration, and single part. I'll go into the totality directly. Causticum was prescribed in 2 doses. So totally, you can see the back pain and everything was ameliorated with initial 2 doses, and second 2 doses was prescribed. So totally 4 doses of causticum 1 m was prescribed. And slowly, it went for a long time. It nearly went for around 8 months to 9 months duration. And then we were giving placebos to the patient. And one by one, the skin tags were falling regularly. So you can see the difference also. So initially, you can find many small skin tags were there. And after that, you can see completely it is relieved. It was a slow process. It is not very quick. It is not immediately falling, but it took nearly 4 to 5 months to completely fall off all the things on both the sides. It was there. So causticum 1 m, 4 doses, cure the patient within 6 months, and the cosmetic problem also is relieved. So this is the better aspect. That means we are treating individualistically, where the holistic aspect of the patient is treated. We are not considering only the one complaint. Lumbago is the complaint which the patient came for, but considering this particular aspect of skin tax, it was prescribed. And once the patient is curing from the internal aspect, both the complaints are relieved. Next is a case of ingrown toenail. Madam, this meeting is still 8:30, no? I'll continue. The case is a ingrown toenail, left big toe for the past 1.5 years, with granulous tissue, and there is inflammation and oozing of blood and pus, pain and tenderness on the affected area. I'll go into the totality. The patient is very cautious, irritability at trifles, desires spicy food, ingrown toenail, inflammation of nails, and pain in the toes. So coming to the totality, we have many remedies, like we thought of nitric acid, we thought of natamure, but finally we settled into the silica. So this is the image which was taken after cleansing. When the patient came, this complete big toe was covered with pus and blood, and we cannot find any of this thing. So after cleansing, after drying up, we have taken the image of the patient. You can see the ingrown toenail, completely the nail is hidden. So silica 10 was prescribed. As we find the correspondence is complete, we thought of going for high potency. The patient is coming from a very long distance, so we cannot go for a frequent remedy. So for 3 months, it was prescribed 1 dose with placebo. So after 3 months, the patient came. You can find how much is the improvement. It has reduced in size. There is a very good improvement. So again, silica tenom 1 dose was prescribed again for 3 months duration. So after that, the patient came completely relieved. So silica tenom 2 doses along with placebo in 7 months duration, the patient was completely relieved. So you can see before treatment how it is, and during treatment the improvement, and after treatment completely relieved. And this also what happens many times, the patient goes for minor surgical procedures, but the patient has recurrence in many of the conditions. But here also there is no recurrence for the patient. This is a case of trichlimal cyst, a single cystic growth on the scalp. The patient initially went for the conventional medicine, where she was advised to go for a minor surgery to remove the cyst. So to avoid surgery, she came to homeopathy. Along with this complaint, she had distension of abdomen, which is there for 4 years, and then after she feels aggravated after eating, and feels better after passing flatters, aching pain in the lower back only during menses for the past 2 years. I'll go to the totality directly. So this is the totality of symptoms: likes company, doesn't like consolation, and fear of disease. And the abdomen is distended, aching pain in the back, and cyst in the head. So going to the repertorization, calicarb has come. So we referred calicarb in Metramedica also, and we find this is suited better compared to the other remedies which came up in the repertorization chart. We prescribed, initially it was only Sacloc was prescribed. After 1 week, then the patient came. This is the image of the patient, where you can find the growth, which is slowly growing and it is increasing in size. Calicarb 200, 2 doses were prescribed to the patient for 2 weeks duration. And after 2 weeks, there is no back pain and distension of abdomen is better. So mostly once you give a very right remedy, the functional symptoms are getting cleared first. So that indicates that our remedy, what we have prescribed, is right remedy. So we went into same Calicarb 200. It got dried up. You can see the initial picture how it is, and after 4 doses of calicarbonicum, the image it is dried up completely. And later on, while she was combing the hair, it got fallen. Dried mass has fallen off, and blood and other things were oozing out. But slowly it was healing, and the patient was put in placebo. You can see the improvement. Patient was only in the placebo for a long duration. So this is the Calicar 200. 6 doses cured the patient within 2 months duration. So before treatment, you can see the image, and after treatment, you can see the image. Completely, it is not only a small, slight budges there, but it doesn't have any issues. And after that, the patient did not come for a very long time. No issues at all. So concluding remarks, homeopathy can cure most of the cases commonly relegated to the surgery. the pseudo surgical cases where conventional medicine has no scope. So it is true that in true surgical cases, homeopathy can play a vital role in pre and post operative stages. So we are reading Bailey and Love or Das, everything. We have n number of cases which are said that this has to be surgically maintained. So it requires a very minimum mechanical intervention. So homeopathy can give you a very wonderful relief. Any cases we have many cancer cases. I have not put it here as many are students here. Cancer cases which has been treated and cured, and very severe aggressive cancers where patient is going for chemotherapy or radiotherapy, and along with that we are giving our medicines, and the patient is maintained their energy pattern which regulates the vitality and then gives a very good results. So homeopathy has a better role in preventing the commonly relegated surgical cases, commonly called surgical cases. So William Osler, one of the famous physician from the conventional medical science, which says that a good physician treats the disease, a great physician treats the patient who has the disease. So it is very much important that homeopathic physicians are treating the patient who is having the disease, by which they are improving the overall health of the patient. So with this, I'm concluding. Any queries?
Yes, attendees, after the session, do you think there are any questions, queries? You may ask freely. Any queries? Any doubts? In chat box, there is a message, sir,
Okay.
by Dr. Bharat. Role of homeopathy in cholesteatoma. Can surgery be avoided?
Pardon, I could not get it, madam. Role of homeopathy in?
Role of homeopathy in cholesteatoma. Can surgery be avoided? This is the question
Depends
by
on the
Dr.
case.
Bharat.
Okay, okay. It depends on the situations, because homeopathically, what happens, what we find is that many cases we say that it cannot be treated or there is no any medicines. It is purely a palliative thing or something like that. But it depends on the patient perspective. So when the patient's vitality is good enough, so commonly when any case comes to us, we commonly divide on the conventional medical science to be a curative or it is a palliative procedure. But what medicine we are prescribing, there is no difference. So we put the totality and prescribe the medicine. If the vitality of this particular patient is good enough to revert back to the healthy state, then your medicine, what you are prescribing, will surely relieve the patient, whatever may be the condition. So don't fix it that this is incurable or curable. Proceed with the totality. The patient will be deciding. That is what is my suggestion to the students. Doctor.
Yes. Dr. Bharat, is your doubt clear? Okay. So there's no more any questions in the chat box too.
Okay.
So
Then I'll just finish my final thing. I thank Professor Dr. Nilima Puhane, and thanks to All India Homeopathic Students Association and Youth Association team, Professor Dr. Arpana Parik, the webinar organizing secretary, for contacting me, Professor Dr. Nivedita Patnayak, Dr. Kataria Lavanya Sai, and the anchors Dr. Ashika and Dr. Aditi Malkani. And thanks all the participants for the patient hearing. Thank you.
yes, thank you. So even we are pleased to have such a good speaker who has already experienced since October 2007 of his own clinical practice till date. And sir who has done his post-graduation MD from Vinayak Mission Homeopathic Medical College, and from and has completed his undergraduate BHMS in 2007 from Father Muller Homeopathic Medical College from Mangalore. Also, we were very pleased to listen from not associate professor, rather professor, which I by mistakenly narrated in the beginning of the session. I apologize for it. And the speaker who has experiences ex-RMO in Father Muller Hospital, Medical College and Hospital, Mangalore, Karnataka, and at present working as professor and HOD Department of Organon of Medicine and Homeopathic Philosophy in RVS Homeopathic Medical College. Along with that, he hello. Along with it, also have 100 articles in various medical and index journal. So it was a good time in this weekend to have a great session from the respected person. I would like that Dr. R. Samaran sir will again be joining with us for sharing the insightful sessions. Thank you, sir.
Sure, Dr.
Thank you
Aditi.
so much.
Thank you. Thank you. Thank you.
We'll terminate the meeting here. Yeah, thank you, sir. Have a nice day. Attendees, there will be a session organized for tomorrow. Again, we'll meet at 7:30. The link will be shared soon. Okay, thank you. Thank you, everyone.
Thank you, sir. Thank you, all the participants. Looking forward for many more, sir. I hope all the participants have cleared their doubts too, whoever they commented on the comment box. So thank you all. Thank you, Aditi. Thank you, ma'am. Thank you, everyone. Yeah.
Yes.